clinic for the last 5 years, the things that have changed my life, the things that have helped my patients. And so I'm so excited. Like, I love sharing it with you guys. I love sharing it on my social. And I really, really, really can't wait for people to check out my book, because, like, to me, it's kind of cool. A book is an old art form, and we can have social media, we can have Twitter and all these different things, but you will never find ever a higher form of human communication than a book. Because when you read this book, it's like literally 9 months of my life that I completely dedicated myself to. And you're getting the best of me. Like, this was me, like, in training mode, like where I'm going to bed at the right time, I'm eating the right food, I'm doing everything I'm supposed to do so I can give you my best. And so then what you get is you get this, basically 300-page book that's what it is. Everything has been meticulously crafted to try to give you the best that I have for 9 months. So I'm excited. I can't wait to share it. You guys will definitely get an advanced copy, by the way.
Yay!
Oh, cool. Can't wait.
I will definitely get you an advanced copy. I think in January, we're going to start to be able to do that. So
sweet.
And the official release date is?
May 12th.
May 12th.
May 12th. Yes. The book, for those of you that don't know yet, the book is called Fiber Fueled. And it's all about the gut microbiome and the way that our gut microbiome interacts with nutrition, and how we can really sort of change our gut microbiome and optimize it with the food that we eat, and also our lifestyle. Our lifestyle is a huge part of it too. So, and we're going to talk about a lot of these things tonight. So we'll definitely be touching on a lot of the concepts, but it's kind of cool because over the weekend, one of my followers on Instagram reached out to me and was like, "Hey, I just ordered your book." I was like, "No, you didn't. There's no way. There's no way. I didn't know that you could order my book. There's no way you ordered my book." And then I went to Amazon. And the cool thing is, if you go to Amazon and you type in my last name, Bulsiewicz, there's nothing else under Bulsiewicz in Amazon. You know what I mean? So if you type in Bulsiewicz on Amazon, immediately my book comes up. And I was like, "Oh my gosh, you can order my book now." So I got to ask my publisher, like, yeah, like, come on, guys. Like, you got to tell me.
Who authorized this? Are you going to be a diva about it? Excuse me, I was not notified about this. I'm notified.
Yeah. So, hey, is this record? Is this going to go out on video later, or is this?
Yeah,
it is.
We're recording.
Oh, cool. All right, nice. Yeah, I would share my cover. It's like I'm looking at it. It's right over there. I have not shared my cover yet. If this was totally live, I would share it. But because if it's going out on video, I can't. So.
Oh, no.
I'm sorry. I don't mean to tease y'all. I don't mean to do that.
You dangled that carrot and then
threw
it away.
So bad.
All right, everyone. So let's dive into these questions. We have a ton of them. So we might have to do a bit of like so people have emailed in first. So they're not in. We'll start with the people that emailed in first, and then we'll jump into, if we have time, into the live questions. Okay. But there's so many, Dr. B, that I think you'll have to be a bit of a machine gun with these answers. So we'll see how we go. Hopefully,
I'll do my best.
Hopefully there's a lot of repeat.
There's usually a crazy amount of questions in the first call. So if we don't get to all of your questions tonight, we can get through it on another call.
Yeah, I'll do. I'm happy to do another call.
Oh.
If you want me to.
Oh man.
Or we could just do an extended remix. Like I'll brew some coffee. We'll go for a
remix.
It'll be a marathon. We'll just go for it.
Awesome. So, okay. Maddie, do you want to read this one? This one comes from Tiny Van Emelin.
Cool. Okay. So this is one's concerning my son sent by email. I never had reflux problems. For a while now, I'm sensing this burning feeling in my chest. It feels sort of like it's burning when I'm breathing, throat, mouth, and even my nose. Could it be caused by reflux? I never feel food coming back up my throat. It gets worse in the evenings. I'm drinking apple cider vinegar before dinner since I've watched the series, drinking vegetable smoothies at noon, taking enzymes at dinner, but haven't gotten any better. How can I know it's actually reflux that is causing this weird sensation? And if it is, what could be the cause and what could I do to make it go away? Thank you.
This is such a good question. And this person has eloquently described for us what some of the symptoms of acid reflux are. So if you're in my clinic, the things that I'm looking for are heartburn, like a burning in the chest. I'm looking for a sour taste in the back of the throat. That's highly characteristic of acid reflux when you get that sour taste. And then some other things that some people will have, they may have regurgitation where food actually comes back up without nausea, it just comes up. or trouble swallowing. And so all of these things that she's sort of describing may indicate acid reflux. Now, that's not the only condition that can make you feel that way. So there are some other things that need to be considered. Let me just put this out there that, anytime you have chest discomfort, burning discomfort, that's right here, substernal, under the sternum, you need to consider the possibility of cardiac issues. And, one of the things that we know is that women and people with diabetes are far more likely to have an atypical presentation for heart disease. So if there's anything else that comes with it, shortness of breath, anything of that variety, palpitations, then you definitely want to consider cardiac issues. And then the other thing that's esophageal, two other esophageal things that should be considered. Number one, spasm of the esophagus can cause substernal chest discomfort, maybe not necessarily burning so much as like a real deep spastic type sharp discomfort. And then the other thing is something called eosinophilic esophagitis, which is an emerging allergic condition, something that was very rare if you went back just 30 years ago. Frankly, if you went back 30 years ago, we didn't even have a name for it. And now it's something that I'm diagnosing almost every week, honestly. It's allergic in the sense that it's conceptually similar to asthma or to seasonal allergies, allergic rhinitis. And so that's another thing that can present similar to acid reflux. But if you say, Dr. B, put your chips on the table, what do you think this is? I think it's probably acid reflux. And if I knew the exact place that acid reflux came from, we would make a lot of money, because this is such a huge issue. This is such a huge issue in the United States and throughout the world. And so it's hard for us to know exactly where acid reflux comes from. It's been an evolution on the medical side. It used to be that we thought that reflux came from obesity. All right, so people who are overweight, they have increased pressure in their abdomen, and that pressure, the theory is pushing the fluid back up into the chest. It's like a physical thing. And the problem is in medicine, we always start from a very simplistic place in our understanding. So it's easy to understand mechanical, like it's just, okay, it's intuitive. It must be that they're obese. But any GI doctor will tell you they have a bazillion skinny patients with acid reflux. It's not just obesity. So what else could it be? Well, we do know that people that have a hiatal hernia, if that is present, are predisposed to having acid reflux. So a hiatal hernia means that there is separation of the normal barrier to acid reflux, the anatomical barrier. The way that we are supposed to stop reflux from occurring is that the bottom of the esophagus, which is a ring muscle, a sphincter muscle that opens and closes like that, that ring muscle is supposed to line up with the diaphragm. The diaphragm is the muscle that sits at the bottom of your lungs. When you take a deep breath, that's your diaphragm stretching down to basically pull air into your lungs. So there's this opening inside the diaphragm, and right in that opening is where this lower esophageal sphincter is supposed to be. And every time you breathe, you don't realize it, but every time you breathe, that diaphragm is pinching on that location. When you separate these two, when the lower esophageal sphincter is up into the chest and the diaphragm is down here pinching, what you have done is you've created a pocket between the two. And that's one of the things that can predispose to acid reflux. There's two other things that I want to mention. A third theory on acid reflux is something called a TLESR. This was very trendy about 12 years ago. And TLESR stands for transient lower esophageal sphincter relaxation. And when we studied this, we didn't understand why this was occurring. It was just occurring. People that had acid reflux would just randomly have this lower esophageal sphincter that I told you is like this. It would just open up and let things flow. And they would get burning sensation when that would occur. We did not understand what was causing the TLESR. But I think I have an idea in 2019 about where this is coming from. We have now started to do microbiome studies. And what we are seeing is that when you damage the gut microbiome, specifically, there is, believe it or not, a microbiome that exists in the area of the esophagus and the stomach. When you alter that microbiome, you alter the motility of the intestine, including the esophagus. And that is what more than likely predisposes to us developing acid reflux. So what's interesting is they have these studies now where they give people dietary fiber and they see improvement of acid reflux. How does that make sense? It doesn't neutralize acid. The dietary fiber is helping to correct the gut microbiome and maybe restoring proper motility. In a similar study, when they gave patients a predominantly plant-based diet, they saw similar results, improvement of acid reflux on a predominantly plant-based diet. So to answer this question, to me, and I'm a gastroenterologist, right? So maybe it's a little bit of have a hammer and see a nail, but what I would do is an upper endoscopy. Okay, an upper endoscopy is a procedure. It takes typically about 5 minutes. It's very quick. And it provides us with exactly the information that we're looking for in this particular setting, which is I can tell you whether or not there's evidence of acid reflux. I can biopsy to make sure that there's not eosinophilic esophagitis. And I can check to see if there's a hiatal hernia. And if there is, then we can have a conversation about what that means and if there's anything that we want to do about it.
Great answer.
Sorry that I went so long.
No, it's good.
Well, a lot of our tribe have issues with acid reflux. So I think that's
common.
Yeah, that's a great foundational answer for a lot of people. So great. So get the test done. And in the meantime, perhaps up fiber in your diet.
Yeah, I definitely think so. And you know, the conversation on medications in this setting, you know, I think the important thing from my perspective, what I really want to get out to the listeners at home today is these medications are completely inappropriate if a doctor puts you on them and never reconsiders whether to take them off. That's crazy. We should never be doing that with any medicine. There is no medicine that would be safe to just put that on and never take it away. And that is, to me, the biggest problem that I've seen with these medicines. There can be a role of medicine for the purpose of healing the esophagus. Many times what I find in my practice is that a person who has rip-roaring out of control acid reflux and they're suffering, you need to heal the esophagus. And when you heal the esophagus, then everything is strong again. The tissue is strong because it's been healed. And now the problem goes away completely. You can withdraw the medicine. You don't need it. Okay. So the point from my perspective, though, is that when we talk about those medicines, you can debate the role of those medicines for short-term use, but in long-term use, that's where I think I take issue, because we shouldn't be so quick to just slap that down and move on with our life and not talk about lifestyle and diet and all these things.
Mm-hmm. Mm-hmm. Okay,
That's
great.
awesome. And it's such a huge industry, right? Like just acid reflux in general, like it's a massive money. It's crazy. I don't remember stats off the top of my head, but it's insanely big.
There was a period of time when I was in my training like 10 years ago that 3 of the 10 most prescribed medications in the United States, think of that. Think of how many prescriptions are going out. 3 of the 10 most prescribed medicines in the United States were of this class of proton pump inhibitors. And there was a 4th medicine that was not technically on that list, and that was because it was available generic over the counter. So it wasn't being prescribed, but people were using it because they were buying it over the counter.
Huh. Wow. Huge problem. Thanks for shedding some light on that this morning, or your evening. Okay, so there's a bit of like mutiny happening, right? Not mutiny. So the light. Okay, I've seen the chat, and so I will alternate between the emailed questions and the live questions. Okay, I'll go one for one. So I'll do that. And secondly, everyone who is new, a little bit of housekeeping. The chat box that you're chatting in, that's just for chatting, and ask your actual questions for Dr. B in the Q&A box. So you can, at the bottom of your Zoom screen, you should see a little box called Q&A. Just click on that and you can ask your questions there. So
do you get nervous speaking in front of 350 people, Dr. B?
No. No, I love it. I love it. Well, first of all, they're not physically here in front of me, right? So
if you could imagine it, it was like
I feel like I'm talking to my 2 friends, you know? So for those of you at home that don't know, like I know Sarah and Matt, I've bumped into them a couple of times now, and I think they're wonderful and they're lovely people. And so it's just like, I feel like I'm talking to my friends here, and there just happens to be 350 voyeurs.
That's awesome. Okay, so so this question comes from Amanda. She is asking, how much of our diet should be grains if we are plant-based? Does it change if we are eating meat? Are there any across the board okay, that's a different question. So let's start with how much of our diet should be grains.
So grains, I thank you, Amanda, for bringing up this topic, because it's a topic that I think needs to be discussed more frequently. Because we hear grains being vilified out there. People are saying, not nice things. And I think that the conversation requires more, like so many things, we require more nuance. We need to peel apart the layers here and talk about this in more detail. Because to me, so highly refined processed grains, ultra processed grains, it's completely different from whole grains. It's completely different. A whole grain is something that is grown, it's natural, it comes from the earth. And these highly refined processed grains are completely different. Now, we can talk about organic and GMO when it comes to whole grains. I recommend that we roll with organic, and that way that it has not been sprayed with glyphosate. That way that it has that those herbicides that we have concerns about aren't going to be adherent to our food and potentially poisoning our microbiome. But when you get into this, so if we take, let's just do this real quick and easy, that if you take ultra processed grains, no, we don't need those, right? If you eat those, you're eating them as a treat, and it's not good for you. That's like having a cigarette, right? Whole grains, on the other side, these are foundational foods for our gut microbiome. These are foundational foods for our gut microbiome. And there has been study after study, there's questions, do whole grains cause inflammation within the gut? If you look at it in a test tube, which is not obviously natural, you can sometimes find studies that find inflammation. When you look at it in a real person, there is no evidence that whole grains cause inflammation. The evidence when it comes to the microbiome is actually that they support a healthy gut microbiome. A big part of the reason why is the fiber that you get from whole grains feeding these gut microbes, and then those gut microbes taking that fiber and metabolizing it and releasing my personal favorite thing, I think really truly the currency of gut health, which are short chain fatty acids. Those get released from these whole grains. And so when they do studies looking at whole grains, they see more of the microbes that produce short chain fatty acids, and you see that there is higher production of short chain fatty acids as a result. When we categorically eliminate grains, we cause trouble. This is why I do not believe in categorical eliminations of plant foods. And so there was a study that came out actually out of Australia where they looked at a Paleolithic diet. And they were curious as to what they were going to find, because the Paleolithic diet, of course, teaches that you should eliminate all grains. They say that those are not, foods associated with that diet. And what they discovered in this study is the more strict that you were adherent to a Paleolithic diet, the more damage that you caused to your gut microbiome, less good guys, more bad guys, and a resulting higher level of a biomarker called TMAO. And TMAO is very hot in the research realm right now, because TMAO has been associated with coronary artery disease, stroke, peripheral vascular disease, atrial fibrillation, congestive heart failure, chronic kidney disease, type 2 diabetes. It's not good. You don't want that. And these people who you would describe as eating clean, they are actually more strictly adherent to the Paleolithic diet, are actually causing more harm. And what they discovered was this was deeply associated with how strictly they eliminated grains from their diet. So grains are foundational foods for the gut microbiome. You should not eliminate them. Whether or not you consume meat, to me, is a totally separate question. But the key from my perspective is we need to keep grains in the diet. I don't know that I would go so far as to define like a percentage of calories. I don't do that anyway. I just think a couple times a week, you should be having whole grains in your diet with a nice big meal.
Okay, great answer. I love it. Okay, this question comes from Maria. She says that she's been struggling with gastritis, gut dysbiosis, yeast, and it's been going on for the last 6 years. She has chronic fatigue, headaches, high anxiety. She's been seeing a few functional doctors, but no change in self. So she's detoxing slowly with a naturopath. And she's taking slippery elm, digestive enzymes, and probiotics and licorice. It's yeah. So I guess she's a bit at her wit's end. She doesn't really seem to be improving. If there's any suggestions you might have.
Yeah. So that's tough, because what I'm hearing from Maria is this is someone with a chronic digestive issue. What's clear, based upon the way that she's describing it, and I don't need a test to prove this, is that she has damage to her gut microbiome, dysbiosis. She's describing what a person with dysbiosis has on a number of different levels, including the digestive distress, including the gastritis, but then extending outside of the gut to include the chronic fatigue. And, these are symptoms that we see in someone who's had damage to their gut. I would venture a guess that if I were sitting in obviously Maria is not my patient, but if I were sitting in my office, in my clinic, talking to Maria, I would venture a guess that if I go back through her history, we're going to find a clear-cut explanation for why this came to be where it is, whether it be exposure to antibiotics, exposure to medications to treat acne, something during her childhood. There would likely be something. Trying to fix this based upon that description is so hard for me to do. I wish that I could. But what you're talking about is a person who's been through multiple care practitioners. There's a very high level of complexity and chronicity to her issues. So I think what I would say is this. I come back to foundational elements of, we know that she has damage to her gut microbiome, and we know what the foundational pieces are for the
We just lost Dr. B. Put your hands up if you can still hear Matt and I, or if we've lost everyone.
Yeah, we've got plenty of hands up. Cool.
Okay, cool. So let's just remember when Dr. B. Oh, I think he's back. Hello, Dr. B.
Sorry about that.
No worries.
We good?
Yes. So what were you saying?
Okay.
What your suggestion would be?
So what I was going to say is let's stick to what we know. We know that she has damage to her gut. We know that she would benefit from rebuilding her gut. And to me, we need to take a look at, okay, so what are the things that are critically important when you try to build up your gut microbiome? And we know from, you guys have heard me say this a million times, we know from the American Gut Project, which is the largest study on the entire planet. I mean, it really wasn't just Americans. This was a global study. The largest study to correlate lifestyle and diet to gut microbiome and the health of the gut microbiome. When they analyzed that completely agenda-free, just plug it into the equation and let it kick out what the answer is. When they analyzed it and asked the question, what is the single greatest determinant of a healthy gut microbiome? The answer to that question was the diversity of the plants in your diet. All right. So with Maria, this is not simple. This is going to require the support of care practitioners, including potentially a nutritionist who really understands gut health. But if I have my way, I am going to work with her in the office. I'm going to first make sure that there's no other clear-cut explanation for what's going on. I'm going to make sure that there's no constipation. If there is constipation, we're going to fix that. And then I'm going to start focusing on trying to rebuild her gut with a combination of prebiotics and addition as opposed to subtraction when it comes to her diet.
Mm-hmm. Mm-hmm. Okay, great. Thank you. Matthew, let's go with this one.
Cool. So this comes from Wendy. A person has undigested food, pepper, in stool through though digestive enzymes have been taken. What is the reason, and any suggestions, please?
Undigested foods.
Undigested foods.
That is interesting. So it would kind of depend on what we're talking about. And, there's questions that I would want to know, like, the suggestion is that there is something undigested because it's passing through the intestine so rapidly that it doesn't have time. But even in my patients who have chronic diarrhea, most of them are still able to process and digest their food. So I don't know that there's a simple answer. There are certain foods that exist in our diet, corn being an obvious one, but there would be others that are more fibrous type foods that our body is simply incapable of breaking down. And therefore, when it goes in the mouth, however you chew it up, it will go down and then pass through in its native state. So I don't know that I have a great answer to that one. Sorry.
Okay.
It's all good.
All right. Okay, this question comes from Jeannie. Hi, I was diagnosed with fibromyalgia, hypothyroidism, and IBS around 10 years ago. I had my gallbladder removed 12 years ago. I'm wondering where I should start to heal my gut.
So once again, very similar to Maria, who we were just talking about a moment ago, you know, what I'm hearing from, this is Jeannie?
Yeah.
Okay. What I'm hearing from Jeannie is a similar story. Fibromyalgia is associated with alteration or damage to the gut microbiome, which we term dysbiosis. Hypothyroid, again, associated with alteration or damage to the gut microbiome. Obviously, irritable bowel syndrome, again, associated with alteration or damage to the gut microbiome. So we have confirmation that there has been alteration or damage to the gut microbiome. You know, from my perspective, I don't, know that we need to rehash everything that I just said with regard to Maria a moment ago. It would be a very conceptually similar approach to this type of chronic type of problem. But I think that the important thing to understand is the number of different conditions that are associated with dysbiosis. And maybe this is a good opportunity for me to teach a little bit about what dysbiosis is. So, you guys have potentially heard this expression. You watched The Gut Solution, but you also have heard the expression leaky gut. And essentially, we're talking about the same thing. So there are 3 steps to the development of dysbiosis. So I want to walk the listeners at home through what these 3 steps are. All right. Because basically what you start with is a loss of harmony of the gut microbiome, a loss of harmony. And so what does that mean? It's not so easy to define, but if we're being kind of simplistic about it, there's 2 major concepts. Number 1, it is a decrease of the good guys and an increase of the bad guys. Less anti-inflammatory microbes, more inflammatory microbes. So you lose that balance that was previously there. The other thing that you can see is a contraction of diversity. We have seen in study after study after study, including irritable bowel syndrome, including fibromyalgia, that many of these conditions are associated with a loss of diversity. Okay. So when you lose this balance in the gut microbiome, it's not maintaining the colon and your digestive health the way that it's supposed to. It's not able to maintain it. And this leads to breakdown of the tight junctions. Tight junctions are essentially spot welds that hold the cells lining the colon together. And when you break them open, you create these gaps between these cells and you allow things to leak out of the intestine that are not supposed to be there. All right, so this is where leaky gut comes in. Increased intestinal permeability is the same as leaky gut. So you have alteration or damage to the microbes, you have increased intestinal permeability, aka leaky gut, and then the third step is the release of bacterial endotoxin, also known in the medical literature as lipopolysaccharide. Those inflammatory microbes that I was just talking about, they basically want to release this stuff into your bloodstream. When this gets into your bloodstream, if I literally hook up an IV and I inject this stuff, bacterial endotoxin, into your bloodstream, inflammation is coming. That's what this stuff does. It basically creates inflammation. It's just a question of where in the body it's going to do it. So with Jeannie, I think the teaching point that I would like to get across is when you look at these conditions, this is what's actually I want people to understand what's actually happening in the gut. There's an alteration of the balance of the microbes. There's increased intestinal permeability, aka leaky gut. And as a result of that, you have the release of bacterial endotoxin into the bloodstream. And if you can fix the microbes, they will fix the tight junctions, and that will stop the release of the bacterial endotoxin. And if you want to know what actually fixes all three parts, the answer is what I already told you earlier in this webinar is, from my perspective, the currency of gut health. And that is short chain fatty acids, specifically butyrate. Butyrate, which is produced by these anti-inflammatory microbes when they consume prebiotic fiber. Prebiotic fiber goes to the colon, mixes with the anti-inflammatory microbes, they release butyrate into the colon, and it heals it. All right. Now, obviously it's not that easy for the people who are suffering. I would love if it was just your disease is gone, right? But the point is, we need to build the gut back up so that you are getting that butyrate. And you can't do this by eliminating fiber. Fiber in those patients, I think this is the second teaching point that's very important. In those patients who have damage to their gut, the consumption of fiber is going to be hard. It's going to be difficult. All right. That is actually what they need the most to fix their condition. I'm not sitting here and telling you that you should suffer through it. I'm not saying that you should go and take the maximum fiber you can possibly get into your diet. What I'm saying is we need fiber, but there's a certain amount that is going to trip the wire and be too much for you and upset your gut. And so we need to strike that balance of giving you the right amount of fiber. And then over the course of time, and not like in 1 day or 2 days, I'm talking about over the course of months to years, escalating the fiber dose, building up the strength of your gut, allowing it to get better and better and better at handling fiber, producing these short chain fatty acids. And that is how you reverse these issues.
Wow.
Nice. Well said.
Mic drop. Boom.
Get off of me. Get off of me.
That's such a good answer. We've heard so many variations of leaky gut and that, but yeah, it was so clear and concise and to the point that, yeah, thank you so much. It's going to help a lot of people.
Okay, this question comes from May. She says, I was really interested in what you've said about constipation. Is it possible that IBS-A is actually IBS-C? Are there ways to tell if my reflux and bloating are more likely to be caused by constipation or SIBO? I have a history of antibiotic use, chronic fatigue syndrome, IBS. So I guess how to tell if you've got...
answer this. This is a good one.
Yeah.
Yeah, this is a good one. I'm really glad that she's asking this question. Is May live on the call, or is this an email?
Yeah, she's here.
Okay, nice. What's up, May? So, all right, this is such an important issue. I am seeing epidemic constipation in my clinic. Epidemic. This is a huge part of what I deal with. And I want people to understand that there are so many people who don't think that they're constipated, and yet the constipation can actually be the driving factor for their problems. It's just that they don't think that they're constipated. So they're like, there's no way I'm not constipated. And then I get a CAT scan and I prove that they're constipated. So I want to teach people some of the little tricks of what to look for. Okay. One of the things is you can literally have a bowel movement every single day and be constipated. You could literally have a bowel movement every single day and be constipated. So don't allow that to trick you into thinking that you don't have a constipation problem. The problem in that particular setting is that you're not completely emptying your bottom. So if you have a bowel movement, but only 70% of the bowel movement is actually released, that means that you trapped 30%. Trap that 30% day after day after day, and it's like a compound interest, except it's poop that's growing inside your colon. And you get to a point where you're super backed up and you just don't realize it because you're going every day. So you're like, I'm going. There's no way. So if you feel like you're incompletely emptying, constipation needs to be considered, even if you're going once a day, twice a day. It doesn't matter what the number is. If you don't feel like you're completely emptying, constipation needs to be considered. The number one cause of gas and bloating that I come across is constipation. All right. And it's an interesting topic because gas and bloating, there is this vicious cycle that exists between constipation and gas and bloating. And you need to be careful because someone may diagnose you with SIBO and then subject you to antimicrobials or an antibiotic, and that's actually going to make your gut worse. And if the problem is not SIBO and it's constipation, and we didn't properly correct that, it's a huge mistake. This vicious cycle that I'm telling you about, here's what happens. When you get constipated, you produce more gas. very clearly demonstrated in our studies. When you get constipated, you produce more gas. When you produce gas, you get more constipated. That's the vicious cycle. Okay. They actually affect each other. This is a huge part of the reason why when someone says I have gas and bloating, I'm instantly like, okay, is this person, every single time I have to ask the question, are they constipated? And they could sit there and say, but doc, I'm having explosive diarrhea, right? I'm having explosive watery diarrhea. And you would assume that there's no way they're constipated. The most severe constipation presents with diarrhea. The most severe constipation presents with diarrhea. So here's what's happening. It's called overflow diarrhea. The classic story, first of all, classically, this is like a 70-year-old woman. But just know, like I treat plenty of like teenagers and 20-year-olds with this exact same issue. The classic story is the person who's like, I've been constipated my whole life and then I flipped to diarrhea. Now I'm having diarrhea. I used to be constipated. Now I'm having diarrhea. And what's going on is it's called overflow diarrhea. And you have a column of stool that is stuck. All right. And for lack of a better term, it's a log jam. So the solid stuff is backing up behind this log jam, and the liquid is sneaking through the cracks and the crevices and comes down to your bottom, and it comes out as liquid diarrhea. And so you assume, gosh, I got diarrhea. So what do? In the United States, you go to your store, you go to your pharmacy, and you pick up Imodium, all right, which is loperamide, and that is an anti-diarrhea medicine. And you know what you're doing? You're making your problem worse. You will actually make it better temporarily because you will slow down that liquid that's trying to come out, but you will make your constipation worse. So any person who has gas and bloating, we have to entertain the question. And if they're having gas and bloating and explosive watery diarrhea, we have to entertain the question, could this actually be constipation with overflow diarrhea? Not that it is 90% of the time, but it is more than you would realize if you're not, specifically if you're not thinking about this. So constipation is widely prevalent. It can present with a bowel movement every single day. It can present with someone who has diarrhea. It can also present with the person who cycles. And it's like a slingshot, all right? It's like a slingshot that I'm pulling back, because what this person who cycles does is they skip a day, okay, 2 days without a bowel movement. Third day, the first bowel movement is kind of solid, maybe even a little hard, and then it's diarrhea the rest of the day. Well, what's happened there is that your colon is revving up to try to get all this stuff out, and you haven't gone for 2 days, and then on the third day, you just get it all out, all in one day. That's a constipation problem. That's not diarrhea. That's a constipation problem. And the key with that is rhythm. The key of that is rhythm. The key to all of these issues, gas, bloating, other symptoms from constipation, abdominal pain, classic locations, left lower quadrant, left upper quadrant, right side, all of these places, it can present like a gallbladder. I've seen it present exactly like a gallbladder, but it's not the gallbladder. Nausea and vomiting, acid reflux. All right, gas, bloating, abdominal pain, nausea, vomiting, acid reflux can all be symptoms caused by constipation. What do? You treat the constipation. You treat the constipation. You get the constipation off the table, okay? And then once you have established a rhythm, it's amazing how people feel. They feel so much better. And the key is, like you guys know, I've already made it very clear. I care about diet. I want fiber to be a part of what we're doing. I want plants to be a part of what we're doing. Plant-based diversity is the #1 determinant of a healthy gut microbiome. But I will tell you right now, you come into my clinic, and if I think that you have constipation, we're not talking about diet at that visit. We're talking about your constipation. We're going to fix your constipation. And then once we fix your constipation, then we're going to turn our attention to your diet. But I will not be ramping up fiber and trying to do those things when you are actively constipated. Mic drop #2. Boom.
Yeah, I know. That's such a wow.
I'm going to peacock at some moment here. I'm going to drop these headphones and I'm just going to peacock for you guys.
Yes. I would love that. Okay, so when you say I'm going to deal with their constipation. I'm not talking about diet yet. I'm dealing with the constipation. What does that mean?
Well, so many times what that means is, number one, you need to break, if you're worried that there's like significant constipation, for example, the patient I was telling you about who has the overflow diarrhea, right? You can't move passively into that. You can't move passively into that. You have to do something that is profound. And so from my perspective, what I like to do is I will start with a bottle of magnesium citrate. All right. So a 16-ounce bottle of magnesium citrate will help to at least get them 2, 3, 4 bowel movements. It's not going to empty their colon to the point that I could do a colonoscopy, but it will empty their colon enough that you have disrupted the log jam. And then what we need to do is we need to get them into the flow state. We need to get them into that rhythm that I'm talking about. So we can't wait until you're constipated and then treat it. That's not the rhythm. To get you into a rhythm, we need something that you use on a daily basis. What are our options? We have a lot of them. So I personally am a huge fan of the combination of prebiotic fiber and magnesium. I love the combination, okay? So again, I'm going to try to mobilize what I think is there if there's a significant constipation issue. Once I get that moving, I want to get you into that rhythm. The prebiotic fiber, number one, I've already told you, it feeds and nourishes the healthy microbes that live inside of you, the anti-inflammatory microbes, okay? Number two, it helps to give form and shape to your stool. There is only one thing that I can give you, whether you have diarrhea or constipation, that will correct both of those issues. That's fiber. That's the only thing that I can give you for both of those things. Whereas if I'm worried that you're having diarrhea, any other treatment that I give you is going to be an anti-diarrheal medicine. But what if it's overflow? You see? So the fiber gives form and shape to the stool, and then I add the magnesium, and I adjust the magnesium dose slowly to find the sweet spot, because the magnesium is your softener. The magnesium is your stool softener. And so what you want, not to be too graphic, but look, I'm a gastroenterologist. We're talking about poop, so I'm just going to go for it. What you want is you want a soft but formed stool, like a sausage. Like a sausage. So you want a soft but formed bowel movement, and you want to adjust that magnesium up or down to try to get yourself to that place and keep things flowing. And this is not, hey, keep things flowing like, hey, here's the number of bowel movements that you should be having. This is keep things flowing because you are evacuating your bowels and you are not having gas, bloating, or other symptoms as a result of that, because you are in that flow state. You are in that rhythm. Now that you're in that place, okay, let's talk about diversity of plants. Let's talk about ramping up your fiber beyond just this little prebiotic supplement.
Awesome. So good. Someone had a question. Do you have a certain prebiotic fiber brand or anything that you recommend?
Gosh, I feel so apprehensive to publicly like say something about a specific brand. So
is there anything people should look for if it's not a brand?
Yeah. So there are a number of different options that you can get. Okay. There's a number of different options. I think that the key, and what's very simple to understand, is that prebiotic fiber is this soluble fiber. Prebiotic fiber is the soluble fiber. And so soluble fiber means that if you put into a beverage, it dissolves. Like you literally can't tell. So I use a prebiotic supplement on a daily basis, and I actually put it in my coffee. And I'm one of the world's biggest coffee lovers. You literally cannot tell that it's in. If it ruins my coffee, I wouldn't do it. I'd be like, screw gut health. I'm not doing that crap. So I need my coffee. I'm addicted. So, but I'm able to sneak it in there, and you literally can't tell that it's even in there. It doesn't like make it thick or gelatinous or anything crazy. It doesn't change the flavor. You literally can't tell. It's the same cup of coffee. So a couple of options. Let me just rattle off a whole bunch here. You could do acacia powder. You could do beta glucan. You could do partially hydrolyzed guar gum. You could do wheat dextrin, which I understand like it comes from wheat, but it's derived from wheat. It's not the actual wheat. In people that have celiac disease, I tell them not to do that. Let's see, what else? I'm probably forgetting a few, but that's the bottom line. Those are the ones. Psyllium husk is very popular. With psyllium husk, of course, you put psyllium husk into some sort of beverage and it maintains its grit, and that's because that's the insoluble fiber. psyllium husk is not purely insoluble fiber. It does have some soluble fiber, but just understand that it's not a predominantly prebiotic fiber. It's mostly insoluble fiber that basically mobilizes. Like it's like a plug that pushes stuff through.
Mm-hmm. Mm-hmm. Fantastic. So good. So good. I think that's like the best piece on constipation we've ever had.
Yeah,
that's
so
awesome.
good. Thank you so much. It's a bit of a long question we have. This is an emailed one. So basically, she's dealt with high cholesterol for almost 20 years.
56-year-old woman.
56-year-old woman. A year ago, I'd already begun doing some of the things you suggested in the episodes. I basically cut out wheat, dairy, and cut back on meals. Meat, sorry. I was aware of how much stress can damage, and I implemented ways to cut back on stress. Basically.
What about the raw, unfiltered apple cider vinegar?
Oh, yeah.
So she's heard that apple cider vinegar is good for health. What do you think in terms of her, because she has a stomach ulcer and osteoporosis?
Yeah.
In terms of apple cider vinegar specifically?
Mm.
You know, that's really tough because I worry. So I think you have to follow your intuition to some degree with this. We don't have great studies to tell us whether or not apple cider vinegar is going to exacerbate that stomach ulcer or not. There certainly may be patients who see improvement because the apple cider vinegar is helping to correct their gut health issue. And then when their gut health gets into the proper place, they have better healing. But I think that the thing from my perspective is if you are drinking the apple cider vinegar and you feel like your ulcer is being exacerbated by it, or if you had evidence that your ulcer is being exacerbated by it, then you have no choice. You have to back off from the apple cider vinegar.
Mm-hmm. Okay, good. Okay. What?
We're getting a few questions around skin, the impacts of like how the gut impacts skin, or if they've got certain allergies or skin allergies.
So one person Jack is asking about patches of skin that lose their pigment, if there's a gut connection, and somebody else is asking about eczema around the nose, and if there's gut things they can do to help with that.
So I think let me say this, like not my area of expertise. Okay. You know, I'm not a dermatologist. I'm a gastroenterologist. I never treat skin issues. Clearly there is a gut skin connection. Clearly it exists. And no matter who you are, whether you have skin issues or you don't have skin issues, trying to optimize your gut microbiome makes sense, right? Whether you have disease or you don't have disease, if the path to better health is through the gut, why would you not do that? And so I think the important thing from my perspective is, you know, I can't promise that you're going to correct these dermatologic issues through the treatment of your gut microbiome. But I can guarantee you that the path to better health throughout your entire body is by trying to optimize your gut microbiome. So why would you not at least give it a shot? And of course, continue to work with a professional locally to deal with the skin issues. There is a book that I have to come clean and admit that I have not personally read, but I am friends with the author. And the author, her name is Dr. Whitney Bowe. She's a dermatologist in New York. And she wrote a book. I think they actually changed the name of the book on a newer edition, but it was called The Beauty of Dirty Skin. But basically, if you look for Dr. Bowe, B-O-W-E, Dr. Whitney Bowe, she has a book that's completely about, you know, the gut skin connection. I can't say much more about it because I haven't read the book myself.
Mm-hmm. Mm-hmm. Okay, great. Okay, what about this question? This comes from Dinara. So she said, she has a bit of feedback. She said at the start of the series, she switched to a dairy and gluten, sugar-free diet, and she's lost 7 pounds, gained energy,
Hey.
mood has improved
Hell yeah.
substantially. So that's awesome. That's great to hear, Dinara. So her question is about her son. He's in the hospital at the moment undergoing IV antibiotics. He was born with brain damage and later developed a seizure disorder. He struggled with chronic constipation his whole life, takes Miralax daily, but needs to soak in the tub for hours in order to have a bowel movement. His developmental age is 9 months to 2 years in various areas. He's legally blind, is wheelchair bound for the most part. So the question is, so she's trying to improve his gut health, but and I guess the concern is he's going through antibiotics at the moment as well. So what type of probiotics do you recommend and for how long? She's giving him yogurt and he loves that, so that's great. It's an unsweetened coconut yogurt. Do you recommend any other protocols? So there's a lot happening here, but how can we make sure her son's gut health is has the best chance?
Did she say how old he is?
Doesn't
9 months to 2 years.
Yeah, she doesn't say how old he is.
That was more like a neurologic development type thing. So, I mean, first of all, let me say that obviously, so I'm a dad. You know, I sympathize tremendously with someone who's going through this as a parent, because I can definitely tell you, having kids, that I would rather it happen to me than to my children. So, so I can certainly sympathize with this, and there are a couple things that I do have to offer, but I am not a pediatric gastroenterologist, and I certainly am not giving any, directed advice, because I can't. That's not what I do. But what I will tell you is this: 2 things. Number one, there was a study that I think is relevant to every single person who's listening, not just people who are trying to optimize gut health for their children, who are on antibiotics. There was a study that came out in September of 2018. It was published in the journal Cell. It was out of a very, very reputable institution in Israel. And it was asking the question, what happens to our gut microbiome after antibiotics? And they did a more thorough, more detailed analysis of this than anyone's ever seen done before. And what was interesting is, let me tell you, prior to this study, it was routine for me to recommend probiotics to my patients, both during antibiotic use and after antibiotic use. And I assure you, you will find that most doctors probably will still tell you that you should use a probiotic, but that's because they are not aware of the study that came out in September of 2018, where what they found is that probiotics given after antibiotics actually slow the recovery of your gut microbiome. So the recommendation has now changed to stop giving probiotics. The thing that actually improved the gut microbiome, believe it or not, in this study, and this is a clinical study. They were trying to determine kind of how does this play out. This wasn't real life stuff. But the thing that did improve the gut microbiome was if they took a fecal transplant from that person, gave them the antibiotic, and then gave them the fecal transplant after the antibiotic. So in other words, what they did is they gave them back their gut microbiome, and that accelerated the healing process or the recovery process. So based upon this study, I no longer recommend that we give probiotics after antibiotics. Yogurt is a totally different issue that was not addressed in that study, so I can't really comment on whether or not it makes sense to give your child yogurt. Personally, I'm not a huge believer in yogurt for that particular reason. I feel like there's saturated fat, which is bad for the gut microbiome. Most of the time there's sugar, which is bad for the gut microbiome. So I'm not a big believer in yogurt for the purpose of gut health. I feel like that's more marketing than actual science. And then the other thing that I wanted to mention, and the reason why I asked about the age of this child, is that there is one food that I think is very relevant to children, and we are going to see studies start to emerge not only in children, but also in adults showing us the power of this particular food for the gut microbiome, and that is human breast milk. Human breast milk. If it's possible to get your hands on human breast milk for this child, that's something that I would completely support and recommend. And what's fascinating about it is that we know from our epidemiology studies that children who are bottle fed instead of being breastfed are at far higher risk, not that every single one of them, but are at far higher risk of being obese, of developing childhood cancer, believe it or not, and of developing allergic conditions like asthma, allergic rhinitis, things of that variety, even food allergies. So children who are not breastfed, those are the issues that you see. So what is it about the breast milk? Well, there's sort of the logical explanation, which is that human breast milk has been a part of our relationship with our children for the entirety of human history. We evolved to support these children and support their survival. And that's 3 million years of human evolution. That basically is going into this, liquid that perhaps we take for granted a little bit. From a scientific perspective, there's a lot that we don't know, but here's what we do know. And I find this, by the way, to be absolutely fascinating. In human breast milk, you will find these things called HMOs, human milk oligosaccharides. All right, there's over 200 different HMOs. These HMOs provide 0 calories to the child. They provide 0 nutrition to the child. So why is there 200 of them in human breast milk? The answer is that human milk oligosaccharides, HMOs, are there to feed the gut microbiome. And we evolved. This is where it gets crazy. It's like, what are you talking about? We evolved so that mom would have something in her breast milk for the microbes, not for the child, for the microbes that live inside of the child. And that's because the relationship with the gut microbiome is so critically important. And so my point to this mom is she's trying to figure out ways, and I don't know the age of your child. I'm not a pediatric gastroenterologist. You clearly need to discuss this with your local care provider. But if it's possible to provide breast milk, whether it's your own breast milk or it's breast milk coming from a donor, that's something that I would give very serious consideration to, because there's very little downside and there's tremendous upside. And we're going to see human breast milk being used in studies, not only in children, but in adults too, particularly in cancer patients.
Wow.
Wow.
That's huge.
Amazing.
That's insane. 0 calories and just for the microbiome, the child's microbiome. That is
because
enormous.
It's a prebiotic. That's what they are. These are prebiotics. They're prebiotics. So they're feeding the healthy microbes. So basically, the child is born, we feed the child, but we feed the microbes too. And if you think about, you guys don't have kids, but for the people who are listening who do have kids, you'll know what I'm talking about. When a child is born, their poop has no smell. It's like, it smells a little bit like sour milk because it's just the milk passing through the intestine and coming out. But give it 2 weeks and it starts to change. And that's because the gut is being colonized with these bacteria.
It's amazing. And I guess that's like an amazing blueprint. Nature's given this blueprint of health, really. Like if this is how humans start life and what we need for the best possible chance of survival to, for our guts to basically be colonized, and for that gives us the best chance of survival and for growth, then how much true, that's still true throughout our entire life, but we don't think 100%. Of it like this. We just think about calories and whatever, but we just think we don't think with our gut microbiome first.
Yeah, no, well, I mean, I to me, it's like my entire world is the gut microbiome, but I totally agree. If you read some of the Instagram accounts that went to the Instagram School of Medicine, they talk about calories in versus calories out. And that's all you need for health is calories in versus calories out. And those are people that clearly have no understanding of nutrition. So don't take that advice from them, please. But, I think what's fascinating, talking a little bit more about child development, is that from the day a child is born, where they basically have no microbes, again, their poop doesn't smell because they don't have the ability to process the milk yet, to the time that they're 2 to 3 years of age, you go from this place of no gut microbiome to, by 2 to 3 years of age, you have a fully formed adult-sized gut microbiome. My son, who's 3 years old, has a gut microbiome just as big as mine. You know, I'm way bigger than my son, but his gut microbiome is just as big as mine. And so this is a particularly vulnerable period. And, you know, these things that I'm telling you, that if you replace breast milk with bottled milk, you get allergic issues, you get immune type issues, autoimmune type issues, you get potentially cancer, you get increased risk of obesity and diabetes. We see a pattern. If you look at the epidemiology studies, the same pattern is seen in a person who is born by C-section or a person who is given antibiotics, particularly during the first year of life. So, you know, let me say, like, if you're at home and you're wigging out about this, first of all, don't wig out, because you can have perfectly healthy children and they don't need to be breastfed. They don't need to be. The optimal is breastfeeding. They don't need to be vaginal delivery. Both of my children were born by C-section. We didn't want it to be that way. It happens, right? It's modern medicine. You have to do what's best for your child. If your child needs a C-section, you do a C-section. So that's what we did. And, but I'm very proud of my wife, who breastfed our children all the way up to age 2. And that wasn't the principal source of their nutrition. Once they got past 5 to 6 months, we started introducing solid foods. Solid foods were the principal source of nutrition, but they still continued to get the benefit of the breast milk. And I think what's really cool is I truly believe that it affected their immune system in a way that's very positive, because my kids between them have over 8 years, going on about 9 years of life between my two children. No antibiotics, none, in 9 years of life. They've never been exposed. And it's not because I've been like, well, we're not going to give them antibiotics even though they're sick. They'll have to tough it out. No, they just haven't been sick. They've never needed them. And I honestly think that a lot of that has to do with building up the immune system with human breast milk.
Wow.
That's great. I had a laugh at someone's comment, and Erin is like, I wonder which one of my friends will I ask to breastfeed me? Okay, so I guess, but the question is here, as adults that might have undergone some antibiotic usage, what is the solution here where breast milk might not be, socially acceptable as an adult? But
right. It's not socially acceptable, but anyway.
I mean, you could, but yeah. I mean, I don't know why it's socially acceptable to drink a cow's milk but not a human's milk, but that's a
whole nother issue. Yeah. All right. So I think that the answer to the question is prebiotics. But I think that the other issue is diet. And it's diet, not just like, hey, oh shit. Like, am I allowed to swear?
You do, Dr. B.
You be yourself.
Not supposed to? Okay. I'll try not to. I'm usually pretty good at not. Oh shoot. I need antibiotics, and then you try to change your diet. Like, it doesn't work that way. But what you want, we have these studies that I think are very interesting, where they look at what happens to the gut microbiome based upon someone who's an omnivore versus someone who is vegan plant-based. And what they found is that the person who was plant-based, not only did they have less damage to their gut microbiome during the same course of antibiotics, but the recovery was much faster. All right, so their gut microbiome was supported through the antibiotics and then recovered faster after the antibiotics as a result of the fact that they were plant-based. I would also recommend prebiotics. The beauty of prebiotics, when we talk about prebiotics, I'm talking about two things. Number one, diet, which means plants, fruits, vegetables, whole grains, seeds, nuts, legumes. So I'm talking about diet, and I'm also talking about potentially prebiotic supplements, which we've already covered in great detail. And so prebiotics, the beauty of them is this. Let's just like take you as an example, Matt, just like a hypothetical, okay? If I take you, your gut microbiome is completely unique. It's different from mine, it's different from Sarah's, and it's different from every single person who's listening to this call right now. There's no one on the planet that has a gut microbiome like you, my friend. And if I want to try to alter your gut microbiome and the way that the chemistry works in your gut microbiome, I could give you a probiotic, all right? But the issue is that I don't know how that probiotic is going to fit with your personal, unique gut microbiome. So I'm giving you a generic formula, and I'm hoping that if I throw enough mud up against the wall, some of it's going to stick and do something good for us. Sometimes it does something good. Sometimes a lot of times it does nothing at all. And in rare cases, it can actually hurt people. It doesn't usually hurt people, but sometimes. All right. So that's the problem with probiotics, generally speaking. On the flip side, if I give you a prebiotic, Matt, it doesn't matter what your gut microbiome is. It doesn't matter that you have a completely unique gut microbiome, because what we're doing with the prebiotic is we're selecting for your anti-inflammatory microbes. So we're going to take it and we're going to change your gut microbiome, but we're going to use your gut microbes and we're going to make certain families stronger. There's the rise and fall of families within your gut with every bite of food that we take. And so the foods that are good for the gut, they will make the anti-inflammatory microbes grow. And the foods that are bad for the gut, they will make the inflammatory microbes grow. And that's just the nature of the beast. And when we have unhealthy diets dominated by sugar and processed foods and saturated fats, when we have unhealthy diets like we do in the United States and most of the Western world, then we are feeding those inflammatory microbes. And then we wonder why we have such gut health issues. When I've already told you guys, the pathway to dysbiosis involves a loss of balance with more inflammatory microbes.
So good. Thank you so much.
Very good.
Just quickly on the, we've had a few questions coming through. Just how long would you recommend people start taking probiotics after antibiotics specifically?
How long? Stop.
How long? How long after the antibiotics course? You said it's
at least 4 weeks.
At least 4 weeks. Okay, cool.
In the study, it was 4 weeks before the gut microbiome recovered.
Okay.
So, and let me say that this is not necessarily a universal recommendation. I can conjure scenarios where I might actually still give someone a probiotic after an antibiotic. I can conjure scenarios. All right. But generally speaking, we shouldn't be casually using probiotics after antibiotics.
Mm-hmm. Mm-hmm.
Right.
Wow. So many truth bombs in this session, Dr. B. Your diarrhea is constipation. Don't take probiotics after antibiotics. You're like, you're blowing all our minds.
What do you want me to do? Sorry.
We have some questions here about ulcerative colitis.
Sure.
Did you just scroll this? I lost it. But okay. So we have one question here. Okay, hang on. There's so many questions about ulcerative colitis. I'm trying to kind of get a general question that might help everyone. But how about we just start off with, if someone's diagnosed with ulcerative colitis, what steps would you take them through?
Okay, so let me start, because there's going to be a contingent of people who are listening who know very well what ulcerative colitis is because they live it. But then there's going to be a lot of people who are listening who probably don't know too much about it. So let me talk about it for a moment. Ulcerative colitis is a form of inflammatory bowel disease. When we talk about inflammatory bowel disease, I'm referring to two specific possible conditions: ulcerative colitis or Crohn's disease. Both of these, both ulcerative colitis and Crohn's disease, are autoimmune type diseases. So that means that your immune system has actually turned on your body and decided that your body is the enemy. And therefore your immune system attacks yourself, attacks your intestine. In this particular case of ulcerative colitis, it attacks your colon. All right. And the attack on the colon always starts at the bottom of the colon, meaning the rectum, which is the part closest to your bottom. And then it extends up from that location. So it's a continuous inflammation that starts at the rectum and moves proximal or up through the colon. It could involve just the rectum. We call that ulcerative proctitis. It could involve the lower part of the colon, but that's it. We would call that rectosigmoiditis. Or it could involve the entire colon, and we would call that pancolitis. Okay, all of those things are forms of ulcerative colitis. So as you can see, there's a variety, and it's individualized what a person is experiencing. But in all cases, this is an autoimmune condition driven by inflammation, and at the root of ulcerative colitis, no surprise, is damage to the gut microbiome, dysbiosis. So once again, the root cause of the problem is damage to the gut microbiome. Real quick, before I jump into more about ulcerative colitis, the Crohn's disease, real quick, is inflammation. It's harder to treat than ulcerative colitis from my perspective. And part of the reason why is because it's completely unique to that individual person. Ulcerative colitis at least has all this overlap where it always starts at the rectum and moves up from there. Crohn's disease could affect anywhere from your lips all the way to your bottom, right? It could affect any of those places. The classic locations for Crohn's disease are in the colon and in the last part of the small intestine, which we call the terminal ileum. The terminal ileum connects to your colon in the right lower quadrant of your abdomen near where your appendix is. So when I do a colonoscopy, I have the ability to dip into the terminal ileum and see if there's any evidence for Crohn's disease in that particular location. But Crohn's disease could be anywhere inside the small intestine. It could also be technically in the stomach, although we don't see it often there. Very rare to be in the esophagus. And then when I say the lips, it can involve the lips with ulcers. People will get very bad ulcers in their mouth. And it can involve the bottom, meaning the anus, with anal fissures, okay, which are bad tears of the anal canal, very painful, or fistulas at the bottom. So they could have a fistula where there's a connection between the rectum and the skin as a result of Crohn's disease. You don't see the fistulas or the anal fissures in ulcerative colitis. So you can see ulcerative colitis, to me, look, if I have to have one of the two, I would rather have ulcerative colitis if it's me. So when it comes to ulcerative colitis, the most important thing from my perspective is we have to put out the inflammation. We have to put out the inflammation. And to me, I feel like medication is a necessary thing. It's a necessary thing to get you into remission. I cannot reliably guarantee you that with diet and lifestyle by itself, you are going to get yourself into remission. And I have seen people try it and have it blow up on themselves in a bad way. And because if your colitis progresses and gets out of control, which it very well may, if it's essentially untreated with medicine, if it progresses and gets out of control, it can get you to a place where you have a very, very dangerous, life-threatening form of colitis called fulminant colitis. That is going to end, if you're lucky, it lands you in the hospital and you end up in the operating room and your entire colon gets removed. Some people are not that lucky. So the point being, we need to, once we know that ulcerative colitis is present, if this is a new diagnosis, we need to get the inflammation under control. We need to get you into remission. Once I get you into remission meaning that there is no active inflammation, that if I did a colonoscopy, it would look completely normal. All right, it would look completely normal in the colon. Once I get you into remission, for me, you're not going to hear this from every GI doctor. For me, I want to play the long game. When I say play the long game, what that means is it's time for us to fix the root cause of this issue. So fixing the root cause of this issue means reversing dysbiosis. It means addressing that particular issue and trying to get you so deep into remission that you are asking your doctor, am I cured of my colitis? And the answer is no, you're not cured of your colitis. Once you have it, you have it. But we have you so deep into remission, you've never flared again. That's where I want to get you to. I want to get you to a place where you never flare again. And I do believe that optimization of diet and lifestyle is a huge part of the path to get you there. And in a perfect world, I would greatly prefer to not use strong medicine. I would really prefer not do it. There's a place for those medicines, because if we can't get you into remission and keep you in remission, then we're going to end up with this escalation that could potentially lead to removal of the entire colon. So from my perspective, that's sort of the general approach. I'm sure that you guys can imagine what I'm going to tell you that I believe in. There are some specific things that I'll talk about in a moment, but what I really truly believe in is a plant-based diet. And again, the person who has damage to their gut microbiome, the person who has dysbiosis, these people, they all do. Every single person who has ulcerative colitis has damage to their gut microbiome. That's how you get the disease. And so in that particular person, to implement a plant-based diet is not something that you do casually. It's something that is done with consistency and commitment. It's going to take time. You're going to have to accept that there will be speed bumps. When you have those speed bumps, like a little bit of gas and bloating, that's your gut being inefficient at processing your food. that is not inflammation. All right. So I want to get them on a plant-based diet. A couple other things that I really, truly believe in. This is an immune-related issue. So we should get at the immune system. Yes, fiber from whole plant foods is part of how we get at the immune system using short-chain fatty acids, which we've now talked about like 10 times. The other stuff that I really believe in, high dose of vitamin D, not 1,000, not 2,000, 5 to 10,000 vitamin D, high dose. And the other is omega-3s, specifically DHA and EPA. So omega-3s are a big topic. We could talk for 10 or 15 minutes about them. DHA and EPA are the omega-3s that come from the sea, okay? There's ALA, which is the omega-3 that comes from the earth, terrestrial. DHA and EPA are the ones that we really need in this particular setting with the immune system. You will find them in fish oil. You will find them in fish. What I want people who are listening to, you're going to know more than your doctor about this topic in about 10 seconds. All omega-3s come from plants. All omega-3s come from plants. There is no animal capable of producing omega-3s. We need them. Other animals need them too. They get them from plants. Salmon gets their omega-3s through the consumption of algae. And then they store it. So from my perspective, you can choose what you want. Fish oil is less expensive. Fish oil also has the potential of toxins and other things. From my perspective, I go straight to the source. I want clean algae. I want clean algae oil. And that clean algae oil is going to have the DHA and the EPA that I need to support anti-inflammatory and support my immune system in my gut. So those are two supplements that I really truly believe in for someone who has ulcerative colitis.
Awesome. Four from us. No, that's great. I love that. The omega-3 topic. You again blowing all our minds, Dr. D. Yeah, comes from the algae, not from the fish. It's awesome. Okay, so we'll go for another 5 minutes or something like that. I'm aware of your time. We've been going for an hour and 20, Dr. B. Matt, do you want to ask this question? I'll just get the charger.
Which question? Yeah, so I'm just trying to find something that we haven't. I found this question really interesting, just mental health related. Someone's that's, at least from the doctor's perspective, is totally healthy, blood, urine, stool tests, which are all normal, but really high anxiety, and no explanation as to why. Like, has to take pills to sleep. So what would you, I know that you don't, there's so many factors going into this, but in general, when you see someone present like this, apparently normal, but super high anxiety, what are some things you're thinking from a gut perspective?
Well, so clearly there is the brain-gut connection. The brain-gut connection is indisputable, that our gut is talking to our brain is talking to our gut. It's a two-way street. The second most number of nerves in the entire body is actually in your gut. All right, you have more nerves in your gut than you do in your spinal cord, which is crazy because the spinal cord is part of the nervous system. But the gut is part of the nervous system too. We call it the enteric nervous system. 500 million nerves right now inside of you, feeling and sensing, collecting information, sending that information up to your brain using the vagus nerve. That's one of the major highways of communication between your brain and your gut. And it's a two-way street of communication. When you have stress in your life, it affects your gut. All right. It can actually alter your gut microbiome. Meditation, believe it or not, alters your gut microbiome in a way that produces more short-chain fatty acids. So when I say that I believe that the currency of gut health is short-chain fatty acids, this is the type of evidence that I'm talking about. When you meditate, you improve your ability to produce short-chain fatty acids. On the flip side, when you have trauma, you actually alter your gut microbiome to have more inflammatory microbes. You do the opposite. All right. So this is where, when you see that meme on the internet where they say, you can exercise, you can drink your smoothie, you can do this, you can do that, but if your mind's not right, then your gut's not right. It's true. It's completely true. So there is this connection between the two. I want to add that your gut produces 30 neurotransmitters. That includes 90% of the serotonin in your body. That includes 50% of the dopamine and 28 other neurotransmitters. Your gut is communicating to your brain. It may not always be as direct or as simple as we want it to be, but it's happening. The precursor to serotonin crosses the blood-brain barrier. Short-chain fatty acids like butyrate cross the blood-brain barrier. Okay, so the point from my perspective is that it is very clear that people who suffer with anxiety type disorders, depression, things of this variety, even insomnia, chronic fatigue, that these processes are ultimately coming back to damage to the gut microbiome. And correction or fixing of the gut microbiome is a big part of what we should be striving to do in order to alleviate ourselves of these issues. It's not necessarily so easy as do this and you will fix this problem, right? Like, I can't just say, hey, eat this way and all your problems are going to go away. I wish that were true. But I think the point is we want to optimize the gut microbiome, and that will potentially lead to improvement of the anxiety. And there was a study that came out recently where a predominantly plant-based diet was as good as medication for the treatment of anxiety. And many people who move towards a predominantly plant-based diet or ramp up their fiber will find that they sleep better at night. And it helps to break the cycle, because if you have insomnia and if you're not sleeping, that disrupts your gut microbiome. And when it disrupts your gut microbiome, then you have anxiety and you can't sleep properly.
Mm-hmm. Mm.
So good. So good. Thank you so much for that.
Yeah.
This has definitely been a marathon for you. How are you feeling? Far out, like just dropping bombs and been talking nonstop for an hour and a half.
Oh, it's
love
fun.
it. That's awesome. Well, we've had people from all around the world tuning in. Have we got time for one more question? Yes, you got one more question.
For sure. Let's do it. Let's rock and roll.
Okay, cool.
All right. This question comes from Sarah. She says, "Hi, Dr. B. Could you speak to raw whole foods and veggies versus cooked? Some typically healthy foods can have anti-nutrients when consumed raw. At the same time, certain cooking processes, especially with high heat or certain oils, can also be damaging. Can you clear up any of these issues?"
Yeah, I would love to. I think it's a great question. So let me start by saying this. From my perspective, like I don't lose. I eat plant-based, so full disclosure. And when I say this, I eat plant-based. I changed my diet based upon what I saw in the research. And I did it because I became convinced that this was the key to better health. And I would not go to my patients and ask them to do things that I have not done myself. I mean, I just feel like that would be really, I don't know, really sort of weak medicine to be like, hey, you should eat a plant-based diet, but then like I'm unwilling to do that myself. I used to weigh 235 pounds. My health was out of control. I had high blood pressure. I couldn't control my weight, even though I was exercising like an absolute maniac. And when I changed my diet, I lost 30 pounds almost immediately. I dropped down to 205. And this was a process for me, and it started very simple. So people don't need to like jump into this. In fact, I really actually wouldn't encourage you to jump into this. I would encourage you to make it a process and take your time in sort of making this transition. But so when I say these things, I want y'all to understand, like, I am a doctor. I care about your health. I obviously care about my own health and the family and the health of my children and my family. All right. And when I make these recommendations, it purely comes from that place. Everything that I tell you is coming from, I am convinced by the science that this is the best way to eat. When I frame it as predominantly plant-based, I frame it that way because I want to give you some flexibility. Because there are some people who aren't necessarily going to feel the way that they should right off the bat going 100% plant-based. I want you to have some flexibility. I want you to have progress over perfection, but I want you to strive towards a plant-based diet because that is the best diet for gut health. When it comes to anti-nutrients, getting back to the question, I literally don't even think about them. I literally don't think about them at all. Because when you consume a diversity of plants, when that is the framework with which your diet is built, every meal, when I go to the supermarket, when I'm at the salad bar, diversity of plants, diversity of plants, diversity of plants, every single one of those plants is bringing a unique profile of nutrients. None of them is perfect. None of them is perfect, but you would never eat just one plant your entire life. That would be ridiculous. You're going to eat a mix of many different types, but the broader that mix is, the more different strengths and weaknesses you are basically patching together so that you're getting the strengths. And so to me, I don't worry about anti-nutrients. I literally don't worry about them at all. Now, I do think that this question is very, very interesting because there was a study that just came out looking at cooked versus raw food and the effect that it has on our gut microbiome. And it's coming from a very, very reputable microbiome lab at the University of California, San Francisco. And so what is interesting is that when you cook your food, you change the effect that it has on your gut microbiome. Not necessarily bad. Maybe really good. What you're doing is you're altering the fiber profile. Every single plant has a unique mix or blend of fiber. It's not as simple as maybe I'm making it sound on this webinar of soluble versus insoluble. Those are really broad categories, like super broad. We don't even have an estimate of how many types of fiber exist in nature. There may be literally millions of types of fiber. We don't even know. But every single plant is going to have its own unique mix of fiber. When you cook it, you alter that fiber. And so then you end up with a different effect on your gut microbiome. When we say the greatest predictor of a healthy gut microbiome is the diversity of plants in your diet, the reason why is because every single plant is going to have its own unique mix of fiber to support different families of microbes. So when you eliminate plant categories, you lose the ability to support the microbes that live off of that plant. But when you consume a wide diversity of plants in your diet, you're supporting so many different families of microbes, and now they're all there to give you what you need from a gut perspective and help you, basically thrive. So to answer the question from my perspective, I think that it's really fascinating what we're finding about cooking our food. Whether you're cooking vegetables or meat, whatever it may be, I think it's quite clear that extremely high heat cooking can alter the chemistry in a way that can potentially create, problematic compounds such as carcinogens. So, you're never going to convince me that cooking with oil is in your best health interest. You're never going to convince me that that's true. I'm not of the camp that you need to be like completely no oil at all. I do think that there is a place for some oil, that there is a place for healthy fat, but we also shouldn't be seeking out oil. And here's why. Like, you shouldn't be trying to get more oil. There's people who have like fad diets out there, I'm not going to name any names, that are trying to convince you that you should literally drink olive oil like out of a glass. That makes absolutely no sense. 1 pound, 16 ounces of olive oil has 4,000 calories. How many grams of fiber? 0. Why would you do that? 1 pound of greens? Think of all the nutrition in a pound of greens. 1 pound of greens is 100 calories. Think of the fiber. Why would you give up the greens and replace it with more oil? Makes no sense. Get off of me.
Peacock, we're ready.
great way to end the webinar.
Sorry for the outburst. Sorry for the outburst.
I was gonna ask you to do a peacock round, but you just did it on your own.
Sorry, I apologize. I got a little fired up there. I wasn't meaning to direct that at any particular author.
So, like, for everyone watching, when we interview Dr. B, for our Gut Solution series, there was a lot of these sort of antics that you didn't get to see in the Gut Solution episodes, but I'm glad you're getting to see this fun part of Dr. B's personality now.
Hey, I real quick.
Yeah.
I see some questions below. Some people are asking some really good questions that I want to talk about real quick.
Yeah.
Okay.
People are saying vegan is completely plant-based. So I want to separate these two diets, okay? Vegan and plant-based. They're not the same the way that I see it. Vegan is an ethic. Vegan is an ethic. Vegan is motivated by things that I think are beautiful things and that every single person should learn about and choose for themselves how they feel about it. It's motivated by animal ethics. It's motivated by the environment, the environmental concerns, okay? That is veganism. You can be completely unhealthy and be vegan. You can eat 80% junk food, which many of them do, and be vegan. That is not a healthy diet, all right? When I talk to you, I always use the expression plant-based. You won't hear me use the word vegan to describe this diet because plant-based is what I'm talking about. I am a doctor. I'm talking to you about how to optimize your health, how to optimize the health of your microbiome. And that is plant-based. And what that means is real food. Fruits, vegetables, whole grains, seeds, nuts, legumes. That is plant-based. Now, some people will say plant-based needs to be 100%. And if you're not 100%, you're not plant-based. I'm sorry. I just don't feel that way. I feel that anyone can be plant-based provided they're more than 50% real fruits, vegetables, whole grain, seeds, and nuts. You can't be 20% and tell me that you're plant-based. All right. But what you can do is you can tell me that your goal is to be predominantly plant-based and you're working in that direction. And if you were someone like the average American who's only 10% plant-based, that's the average American. If you're like that person and you go to 20%, let me tell you something. I want to give you the biggest hug on the planet. And I'm very proud of you for doing that. And this is about progress over perfection. And if you go to 20%, I'm your biggest fan. And you move it from 20 to 40, let's keep going. Let's keep going. And I truly believe that you're going to end up being like me, where I got a very, very high percentage. And I got to a place where I was pescatarian. This is the last part of the story real quick. I was pescatarian. I was eating fish. So what that means is I was still eating fish, eggs, and dairy. All right. But I was predominantly plant-based. I weighed 205 pounds. I had lost 30 pounds and kept the weight off. And I was like, you know what? I'm just going to go for it and see how I feel. And I went all the way and went 100% plant-based. I lost another 15 pounds almost immediately. And I never felt better because even when I was pescatarian, I was still needing a lot of like energy drinks in the afternoon to keep my energy up because I work so hard. So, and I just noticed a pop in energy. So the truth is I really truly believe that this is the ideal diet. I believe this is the ideal diet for longevity, for, considering that we live to an average of 80 years, for prevention of disease. It's not necessarily perfect for everyone. So if you are not 100%, it's cool. I'm still your friend. But I do truly believe that a predominantly plant-based diet is the solution for everyone. I really do believe that.
Mm-hmm. Wonderfully said. I really like that.
So good.
And it sounds like you have some fans in the chat. We had some thank yous come through when you were speaking. So everyone, if you'd like to say thank you for Dr. B for his time and wisdom and truth bombs and blowing our minds, feel free to share in the chat. Pat said, thank you, Dr. B. I appreciate your view on plant-based eating. Very balanced, progress over perfection. And
perfection.
Lisa said, thank you, Dr. B. You're awesome. Wish you were my GI. And yes, there's more coming in now. So thank you, Dr. B.
Cool. And if you guys, they may already know this, but just real quick, couple things. You guys, if you want to hang and continue to hang and have these conversations, find me on Instagram under the Gut Health MD. You can go to my website. I just actually put out, I'm starting to put out emails more frequently. And so I just had one go out today. So my website is The Plant Fed Gut, THE Plant Fed Gut, all one word, theplantfedgut.com. Sign up for my email list. And I'm like sharing fun stuff. Like I did a breakdown of this study that just came out today. It was really cool. I got to like, I have 8 years of research training. So it's fun for me when I get to tap into sort of that, academic side and sort of just dissect this study out. So I did that today over my email list. And then we talked about in the beginning, my book is coming out May 12th, 2020. If you enjoyed this concept, everything that you're hearing in this concept is like what you're going to find in the book. But then, like I said, 9 months of my life spent developing this book. So you're going to get even more, it's going to be even more thorough and it's going to be complete. And it's called Fiber Fueled, and you can pre-order it off of Amazon or buy it at your bookstore.
And people on the call are already saying they're pre-ordering it. So thank you so much.
Someone's ordered it. Someone else has pre-ordered. And honestly, Dr. B, I didn't think anyone could give me heart eyes for fiber like you do. I'm just like, oh, I love fiber.
I'm obsessed.
Oh, we have so many thank yous come in. They love you. And this session was fantastic.
Love y'all too.
And for everyone asking, there will be recording. I'll get it transcribed as well for those that either don't understand our accent or just need a little help with their hearing. We'll have it transcribed and captioned as well. And
I was the one with the accent.
Yeah. Well, most people here today are in the US. So everyone definitely sign up for Dr. B's mailing list. I know that I will today after we get off this call. He has a beautiful new website that he's populating with new blogs, and Dr. B's Instagram is great. If you are on Instagram, I really feel like he's someone that adds value to the space on Instagram, and he's always really funny and quirky and a bit like cutting edge, or a bit like, oh, did he say that? So it's great. Give him a follow.
Can't help myself sometimes.
He's a bit of a renegade.
I built a little controversy last night. It got a little crazy. Sometimes my wife gets so upset because my wife can't sleep when it's like people are pissed at me. But anyway.
No way.
Yeah.
What's the title of your book again, just so everyone knows if they want to pre-order it?
Fiber
Fueled. It's called Fiber Fueled. Fiber Fueled. Yeah. So, it's like this entire conversation. So it's far more than just talking about fiber. I mean, this is we talk about fermented foods. We talk about probiotics, prebiotics, food sensitivities, gluten's in there, legumes, lectins, like all these topics, a lot of the hot topics that people want to talk about, the paleo diet, the keto diet, it's all in there. But at the end of the day, you guys can tell what I really believe in here, which is that I believe in diversity of plants. And I really truly believe that the currency of gut health is our short chain fatty acids. And this book is my argument for why this is the truth. I really think this is the truth. And this is our biology. You're not going to change this. It doesn't matter whether it's Matt or Sarah or Will. It doesn't matter who it is. This is human biology. We may have different ways of approaching it, right? When we say plant-based, I can tell you with 100% certainty that plant-based for me is different than it is for Matt and Sarah. I can tell you with 100% certainty because there's 300,000 plants on the planet. There's foods that you guys eat in Australia that I don't even know exist. So anyway, we all need to do it our own way, but I really truly believe that this is the path.
Awesome.
So good.
We can't wait to have you on again. You've been amazing as per usual. And that's why we had you the number one slot. We actually had our biggest Q&A ever. People queuing from questions from all over the world. So many questions, like bombarded with like overload of questions. So if your question wasn't answered, there'll be follow-up Q&A sessions where you can get your question answered. Also, if you're in the Platinum group, post your questions in there.
On Facebook.
And yeah, we will definitely, we obviously covered a lot of topics and we answered a lot of questions with some amazing truth bombs. So, but if it wasn't specifically answered, we will have other Q&As so you can get your questions answered.
Yes. So in the meantime, ask your questions in the Facebook group to get started. And so everyone...
Or bombard Dr. B's.
Oh, yeah. Follow him and ask the questions. Slide into his DMs.
I was going to say, so I feel bad that I didn't get to share my book cover with you guys here live. I really am not allowed to do that. But This is something that I haven't really
We could turn off the
formally announced.
recording, technically.
No, it's okay.
This is something that I haven't really formally announced, but I want to share with you guys since we have 354 people here right now. I'm also developing a course. And so I'm in the process of doing this. So if you sign up for my email list and you follow me closely on Instagram, there are going to be opportunities for people who want to basically help me to develop this course. You know, for example, I'm going to start with a first phase where it's just going to be a small group of people, a core group, and we're going to work through these issues together. And they're going to be getting a lot of attention from me. But the general idea is when this course comes out, which I'm planning for, hopefully it'll be for June 2020, shortly after the book. When this course comes out, the entire idea is this. Look, I'm one person. I got a wife and kids. You know, I can only do so much in terms of sharing this knowledge, but I truly believe in this. I truly believe that I can help people. And so I'm looking at ways to take the experience that you would get from spending not like 15 minutes, but the experience that you would get from spending multiple clinical sessions with me in my office and working through problems. I'm trying to figure out how to bring that to you, these people who are sitting at home right now and listening. And this course is the way that I want to do it. And so that'll be coming, formally launching June of 2020. But for people who are really interested, you can jump on board with my mailing list and my social media, and there will be opportunities for people who want to participate earlier on and help me to build it.
So good.
Early adopters, you're always going to be an early adopter with this stuff. And we're just privileged to have this early access to all the goods and all the information before it all goes public. So definitely taking up on that opportunity if I were you.
Yeah. So for anyone who was watching the call wishing, oh, I wish Dr. B could be my doctor, this is the next best thing. So that's really cool. So
might
for
be
anyone,
better, honestly, might be better because when people are coming to me in the office, I mean, I do give personal advice, but like you understand, in the American healthcare system, I only have 30 minutes. So there's so much more that I want to explain and teach. I mean, you guys can tell I love to teach.
Yeah.
Right. So I could keep going. I mean, we could go for another 3 hours. I'm not going to, because you know, it is what it is. But the point is, like, I love to teach. And so this course is going to be my opportunity to really go long form and then take some of the concepts that are in the book and dive even deeper. So I'm excited about that. Epic.
Yeah. So everyone who's asking for the details again, if you go to the link, how you accessed this Q&A, I have the links there for Dr. B's website and also his Instagram. So it's there, but otherwise it's theplantfedgut.com and the Gut Health MD on Instagram. But if you search, I don't know, Dr. B, Dr. Will B, he'll probably come up as well. Or so he's a thriving community on there. So awesome. So definitely get on his mailing list and keep posted on the Fiber Fueled, and in May, coming out May 12. Very exciting. I'm very much looking forward to my package in the mail, Dr. V.
Oh no, I'm gonna get you guys an advance copy. It'll be fun. You guys will love it.
All right. So thank you, everyone. If your question wasn't answered today, we'll get to it in the next call. But remember, we have 5 more of these and 6 months of these if you're platinum. But ask your question in the Facebook group. And if you don't have access to that yet, swing us an email. So any one of my emails that you get from me, just respond to that and say, hey, how do I access our Facebook group? So in the meantime, I will get this up on the page, the recording with subtitles, but that takes like 2 days to get those back. Sorry, all the housekeeping, Dr. B, that you had to listen to.
No, I love it. Thank you.
But thank you so much for your time. We so appreciate it. And thank you for sharing your wisdom.
Thank you, guys. Always good. Always great to see you guys, Sarah and Matt. And thank you for all the people who tuned in today. I'm honored that you guys come and listen to me talk about this stuff. And I love it. And I wish you all the best. I really do.
Oh, thank you. We'll chat soon. Thanks again.
All right.
See you, everyone.
See you, everyone. Thank you. See you next week.
Oh, wait. Hang on. Next week, it's not on Thursday. It's on Tuesday because of Thanksgiving. So Tuesday next week with Dr. Narala Jacoby. That will be very good as well. So we'll see you then. Okay. For real this time. Bye.